My name is Angela Mullo. I'm the Chief Officer for Aneurin Bevan Community Health Council. My organisation is the Watchdog of the NHS. During normal times, we enter NHS premises to speak to patients while they're accessing care, to find out how they feel about the care that they're receiving. When the pandemic hit back in March, we quickly realised that it wasn't possible for us to visit patients in the normal way. I met with the Director of Nursing back in April, where we discussed the possibilities of some sort of virtual appointment system. That idea was quickly picked up with the health board. So the buddy system aimed to speak to people on numerous wards and numerous hospitals to gain their experience of accessing care through the pandemic. All patients couldn't have visitors coming in to visit them. They were bored. We were aware that they felt isolated and scared. So it was really important that they saw a friendly face that they were able to speak to about the care and have a general chat about how they were feeling today.
I'm Rhian Lewis, I'm Project Manager with the Person-Centred Care Team. I was asked if I wanted to get involved in some work on the ward during the pandemic, which I was very keen to do. This involved being a kind of go-between between the Community Health Council and the patient. Introduce the patient to the Community Health Council member via an iPad, and we used FaceTime to do that.
We visited wards from young adults to children's wards, mental health wards as well. Each ward we visited, there was a very positive, friendly and professional atmosphere. Before we went into the wards, there was a poster that would display exactly what PPE we should be wearing, and that provided us with the confidence and security to enter the wards.
Now, I'm Pat Corey, and I've been a member of the Community Health Council for about 4 years now. When I was asked about the virtual buddying, I was quite looking forward to it, and I welcomed the opportunity.
So the major problem, to be honest, was Wi-Fi issues. We discovered that some of the wards had never had Wi-Fi. As soon as we raised the issue, the CHC let us know that there was an opportunity for patients to use a paper version instead.
Obviously, COVID stopped us visiting some wards when planned, but those visits were put on at the end of the schedule, so it didn't stop us. We found issues with the Wi-Fi. Some wards didn't have Wi-Fi, unfortunately. Those issues have been picked up, and Wi-Fi is being put into those units.
There was a problem with patients who had hard of hearing and obviously couldn't hear us because we had the masks, but I do believe the next project will take that into consideration and ensure that those patients are also enabled to engage.
I can't believe how good the working relationship was between the CHC and the health board. The staff from the health board was there with us all the way through, supporting us and the patients. Although this was distant, I couldn't believe how the patient took to having like a tablet in front of them. It was more relaxed. And when we did go into the hospitals, we used to go in as a little group, and we'd have our clipboards and all, and was very official. And sometimes I felt like that could have been a little bit frightening to the patient. Most of the ones I spoke to were in single rooms. What activities went on, took the patient out to their room, and basically how they got on with the staff. I got to say, I had very much positive feedback, which was great.
I certainly benefited from it personally, and I'm sure the patients did, because I think that interaction with somebody outside the hospital environment is so important. I spoke to people about, their past experience, the work they did, what their expectations were. One theme that came through from every patient was loneliness and isolation, and obviously with COVID-19, that is more emphasised now perhaps than it was. And I gotta say, I really enjoyed it. I like to think that the patients I spoke to enjoyed it as well.
Majority of patients were happy to speak to us. In fact, sometimes it was difficult to stop the conversation because they were really grateful to have someone to talk to and to listen to them. And it was a joy actually to be able to be part of that.
I found that the patient found the conversations as at a time where there was restrictions, and they were telling me they hadn't seen any members of their families for months, and they took sort of having a chat, and it was a chat with me as the highlight of their day, which to me was very rewarding as well.
It was a different experience from when we normally visit and we're going into the hospitals and we're talking to the patients. And I found it, in parts, quite heartbreaking, listening to them, how they miss their relatives and friends. There was one girl, 21, she just missed her birthday without family and friends to be there, to hug her. It makes you realise then how much social contact is. We miss it, and you can imagine patients in hospital, how they must feel without it. But at the same time, it was heartwarming to hear the patients, admiration for the staff on the other side who were working under extreme pressures, but they said they were so appreciative of the way, the care, the treatment they had been given by the staff. I've never known anything that the visiting times that you've gone up onto the wards, or you see the visitors coming in, and it's just so different.
When we found an issue, the health board were able to act on it instantly. And that was really positive for patients because they could see action being taken and their voices being heard. This project lasted 6 weeks, and we spoke to over 97 patients across all acute and community hospitals and covered over 25 wards in total. Patients and members found it really beneficial to speak to someone with a friendly face who wasn't a part of the NHS and have an open conversation about how they were feeling.
I think there's definitely a case now to take this forward, and especially for people that are long-term patients within a hospital. I found interaction with the patients was quite easy, I thought, but I think every one of them, enjoyed the fact that they were doing something different, and that's the most important thing for people's well-being, I think. So I think we need to work together now, the CHC and the health board, to look at what the general principles are going to be for taking this forward and what the strategy is going to be for it.
This project has been so successful. I'm aware that other community health councils and the health boards are also looking at how we work together to deliver the same project across the whole of Wales. Our next project will be involve us speaking to patients in their home. I would like to give our thanks to the health board, because without their help and support, this project wouldn't have been possible, and it's been really beneficial for the Community Health Council and for the patients we've been able to speak to.
What a wonderful experience this has been, both from the patient's perspectives, from the staff's perspective on the ward, and for us at the person-centred care team.
I felt quite honoured actually to be part of it, and I'd do anything like that again, I really would.